This sense of white identity politics was, in some instances, a more powerful driver than longevity or well-being for dictating how people behaved. In very pro-gun communities, what happened was that the people who were pushing for guns the most were also putting themselves at the highest risk, because most gun death is gun suicide. We have about 40,000 gun deaths a year in this country. 2/3 or more are gun suicide. And so of that 2/3, over 80% of that is white men. It's not like red states have any fewer suicide attempts than blue states. They don't. The issue is red states have more completed suicides because when you put guns into the mix, guns are fatal 96% of the time in a suicide attempt, whereas overdose is fatal in about 4 or 5%. And so the minute you add guns to this mix, it's not like suicide attempts go up and down, but fatal suicides skyrocket. We found something that I, to this day, found incredibly jarring. What we found was that there were not everybody, but certain people who we spoke to who had tremendous medical need. But at the same time, they were going to reject the possibility of getting this health insurance, not because they didn't need it medically or financially, they definitely did, but because of this bigger ideology about politics. I looked particularly at the effect of tax cuts on schools. And what happened was, again, the tax cuts were mostly happening at the state level in states like Kansas and Missouri, where I did my research. And what happened was that those tax cuts were eviscerating the support systems, mostly at white schools in those neighborhoods. So what happened after the tax cuts was white dropout rates went up exponentially. And I talked to parents and I would say, does that make you rethink what's happening here? And some people were like, yeah, I've actually changed my mind. But other people were like, it was surprisingly similar to the healthcare debate. Sometimes people would say, I don't want to pay taxes because I feel like people of color are abusing the funds. The dichotomy that I found is people could be incredibly empathic and not racist in their lives, but also be supporting policies or politicians that had profound racial effects and racial implications.